Hey there, welcome back to FMR Therapy. JC here, the People's Therapist. And today I wanted to go over my routine to take care of my forearms. I do body work for a living, but I also like to work on doing things like pull-ups, snatches, cleans, jerks, deadlifts, all kinds of things where I'm gripping barbells and gripping people, and I do a lot of gripping. And so I have to take care of my forearms. I got to take care of my grippers, and the muscles of your grippers are all down here in your forearms. So we're going to do that. I have a couple different things that I'll show you. These are my favorites. So let's just move these persimmons out of the way here. One of the things you need is a hard surface. Find yourself a hard surface. That's going to be the best thing to work on. And if you don't really have a good area with a hard surface, like a table or whatever, that's you just do this on the floor then. Just go to the floor, hard surface on the floor. I like to use lacrosse balls or any other type of ball that has a rubber sort of tacky feel to it. This is a yoga fitness or a yoga tune-up fitness ball, one of Jill Miller's balls. And they have a little bit of a give to them, so I like those for sure. But there's a couple things we need to do. We got to go into the extensors, so the forearm muscles that open the hand, and we got to go into the flexors, the forearm muscles that close the hand, and actually flex the wrist as well. We're going to do some work on both of those. I also so this ball rolls around, obviously. This ball does not. I love this one because it just sits flat on the surface, and it's really grippy and rubbery. This is the AccuMobility ball. They have a couple of different hardnesses. I like the blue one, and I do sell those on my website, www.fmrtherapy.com. Check it out. Okay, so what I want to do is get into the extensor group. Now, there's two bones in my forearm, right? So when I go to just put pressure on that back side, you actually need to get up and over, right? You're going to need to really, I'm going to move my stool out of the way here. You're going to need to really aggressively get up and over because you want to be on the hair side of your arm, right? So it's really about getting some pressure in there. And then I'm just going to hold my forearm there, and I'm going to open my hand and close my hand and move my wrist around like that, right? I do like to do this off of the edge of the table because then my hand can go backward, right? I don't have to worry about the surface of the table. But I'm just holding the ball in one place, and I'm just moving my hand around, open, close, pull the wrist up, pull the wrist down. And then I'm going to move up and find a new spot and do that exact same thing. I'm just leaning my body over so that I can get that pressure right on that part of the ball, and then I'm just moving my hand around. Again, I love the non-rolly ball for this, just because then I don't really have to hold on to it that much, and I can actually just kind of maneuver myself. I can actually take my arm and do some twisty-roos, and now I'm literally taking the fascia and the skin and just twisting it around like so. I love that kind of stuff. Just like I said, we also need to get into the forearm. Same thing, I'm just going to put some weight right on the forearm, then I'm going to put some pressure on it, and then I'm going to do some flexing and then not flexing. I'm going to squeeze my hand closed, you flex my wrist, and then I'm going to open my hand and not flex my wrist. It's just all over the place. I'm all over the place with what I'm doing with my hand. And then you're moving up, right? You really only need to stay on this portion of the forearm. You don't need to get into the tendons of the wrist there. Same thing back here. You don't really need to go all the way up to the wrist. Just stay on that meaty portion of the forearm. But you'll notice I'm not taking a ball and rolling it back and forth in my forearm, right? That's not going to work. That doesn't actually release any tissue. These are really, really strong muscles, these grippers. You're using them all the time. So I don't need to just glide back and forth over them. That's super cute, but that's not going to work. I need to really put some pressure in there, and then I need to move the joints that these muscles are affecting, just with pressure just staying right in there. Alrighty? That's how we're going to work on our forearms. Don't forget the extensors. Do this part. Make sure that you're moving your hands and your fingers all around while you're doing that. Stay on it for at least a minute or two per arm. And that should do it. 3 days a week, 4 days a week, something that's helpful. All right, that's it for your forearms, you guys. Thanks for sticking around.